See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
We were constantly being contacted by our friends and our families and our colleagues for mental health referrals. They were having a lot of difficulty navigating this mental health system. They did not know how to find a therapist online. They didn't know the difference between a psych NP and a therapist. They couldn't find a provider that took insurance. Nobody was answering their phones. Nobody was returning emails. There was not pricing transparency for private pay services. And everybody in my network was at full capacity.
I thought the world is shifting online and we need to do something online. And we also need to fill this void and this immense need that's going to be coming up with the pandemic.
They were already feeling so low and depressed and anxious and being re-traumatized in the process of trying to access care. Pritma and I felt there was a real time-sensitive need for an online psychiatry and therapy office that was super responsive and kind at every moment of the client journey.
Within 45 days, we launched Lavender Psychiatry.
Welcome to See You Now. I'm Shauna Butler. There is universal agreement. Mental health services are in desperate need of innovation. What has been less clear is how to address it when across the globe, there are just not enough mental health care providers. Innovating to improve our healthcare systems and health outcomes is a tough gig and not for the faint of heart. Healthcare innovation includes several challenges. There's the scientific portion, understanding diagnosis and treatment of a condition. There are the training and licensure matters. There are regulatory matters that address safety and efficacy. There are matters of delivery, the where, who, and how care is delivered. And of course, the financial matters, the questions of cost and who pays. Innovating in mental health and psychiatric services runs up against all of these challenges. And there is another challenge specific to innovating in mental health services, and that is stigma. It's hard, and there have been significant consequences when people put their hand up to say, "I'm not okay," and then seek help and receive treatment. When you're navigating the complexity of the healthcare system, it's never easy. And when you're suffering with a mental illness, as we learn in this episode, it's just overwhelming. And what we also learn in this episode is that it doesn't need to be. Two serial entrepreneurs and clinical innovators are transforming not only the delivery of mental health services, but also innovating the workplace and the workforce for mental health and wellness. Before we get to the story of how they managed to do this, we wanted to get to know a little bit about what made them uniquely skilled, equipped, and positioned to take on this seemingly impossible feat.
I am Bridget Gannon. I am the co-founder of Lavender Psychiatry and the founder of Ivy Psychiatry.
My name is Pritma Dhillon Chattha. I'm a doctorally prepared nurse executive and serial entrepreneur, and I'm the co-founder of Lavender Psychiatry. I've been nursing for 18 years now, and I consider myself super lucky because my nursing career has afforded me so much diversity. Where others may have had to switch occupations, I've stayed within the same occupation, but have done so many different things within it. Started at the bedside and gradually worked my way up within healthcare organizations into nursing leadership and executive roles. And in the last 5 years or so, I've started tackling some of healthcare's problems, particularly within the digital space. So my career morphed into informatics. My first startup was a credentialing software. So I developed a credentialing tool for nurses and providers to expedite the onboarding process. That was my first startup. My second one was Lavender, which is an online psychiatry and therapy office that Bridget and I founded last year in the wake of the pandemic.
I have been all over the place in terms of where I've worked in nursing. I actually worked at a homeless shelter as the associate director of behavioral health for 5 years. And that was incredibly rewarding, meaningful work. But I really wanted to start my own business because I was feeling frustrated in terms of how slowly things move in the public sector. So I started a company called Ivy Psychiatry, which is a group of psychiatric nurse practitioners that provide consultation to nursing home residents. Nursing home residents are really disproportionately affected by mental illness. They unfortunately don't get the services that they need to support them in their mental wellness journey. So that is a group of about 20 psychiatric nurse practitioners. We are currently servicing 50 plus nursing homes in Georgia, New York, and Vermont. And I'm very, very proud of my team because, as you know, through COVID, the nursing home residents have really struggled this year a lot, and mental health support has been super necessary.
Yeah. And the two of you, where and how did you meet?
We met at Yale, completing our DNP projects there.
And did you know that you would work well together as business partners?
We spent 3 years at Yale, and so we became really good friends.
If I know the story correctly, Lavender was not really the first business that you guys were thinking to put together, but certain things happened that required you to pivot. Have I got that story right?
We were driving, Bridget and I, and we were talking about Bridget owns Ivy Psychiatry. I also own a cosmetic injectable practice here in Alberta. And we were talking about what's our next move going to be. And I said, Bridget, the next thing I want to do is help other nurses in being entrepreneurs. I don't want to have another brick and mortar business. I'd rather do something that's more of a franchise, more of a business in a box, and can really help nurses take that next step. Bridget, do you recall that conversation?
Yes, we were driving in the beautiful mountains of Banff.
Yeah.
Pritma's an ideas person, so she's constantly all day long throwing ideas at all of us. Mm-hmm. And we thought we were going to do a franchise for nurses called Bloom Injectables. Owning a business is such a gift, and it's been one of the best experiences of my life. And we feel that nurses really make good entrepreneurs and great business owners, and we wanted to do whatever we could to support other nurses in taking that first step in business ownership.
Yeah, so COVID hit and we had our first franchisee ready to go. And that was in March of 2020. And I believe March 17th, the world shut down and Alberta shut down. And days after that, I went into my clinic to just do some cleanup and a light bulb went off. And I immediately called Bridget and I said, Bridget, we need to pivot right now, because we were thinking about doing this franchise for Bloom Injectables. And eventually we were going to apply that franchise model into psychiatry as well. And I thought, this is when we need to apply it into psychiatry because the world is shifting online and we need to do something online. And we also need to fill this void and this immense need that's going to be coming up with the pandemic and the need for mental health services. So gone is the need for a brick and mortar practice and a physical space. We could do this all online. And I believe that was like March 21st, 2020. Yep. And we launched on May 5th.
Oh, yeah. Okay, wait, go back through that timeline.
Yeah, that was March 21st. And within 45 days, we launched Lavender Psychiatry.
Yep.
Wow. Okay, so that is a really fast pivot to go from one idea to seemingly a very different idea. As entrepreneurs and learning from all of that, how did you guys actually make that happen?
Well, I think we met Pritma and we made a list of all the things that we needed. We needed staff, we needed a corporation, we needed a website, we needed a name, and we needed a bank account. And we just divided all of those elements that we needed to start and just went full force on accomplishing them. And I think we were in such a rush because we were constantly getting requested from colleagues and friends for mental health referrals. So we felt that there was a real time-sensitive need to start quickly and launch quickly so we could really start servicing and supporting people.
Thankfully, too, we had the experience and the learnings from our past entrepreneurial journeys.
Right.
And so
Mhm.
Bridget had the staff. I had the experience in terms of electronic health records and the best of breed there. So I could quickly launch and configure that for us. And we had prior knowledge of marketing and all those things that go into launching a business. So it wasn't our first rodeo in that sense. So that's why we were able to do it very quickly.
Yeah. I think one of the things that really impresses me about that and also inspires is your ability to leverage online tools. So you've demonstrated that in a short period of time and in a point in time when quite literally the world has closed its business doors, you're able to access online resources, online tools, online talent to bring all of the players that you need for you to actually launch this business. That is just remarkable. And I think what it shows is how it can be done and the fact that you're leveraging it into what you've just described as this burgeoning, blooming need of mental health. Brighid, this has been an area where you have enormous amount of experience and expertise. Can you put finer details on the picture of what we're experiencing, scale, scope, size of this challenge?
Oh, Shauna, yeah. I mean, I was looking up the latest statistics this morning and they're alarming. People are really struggling right now. The number of adults that are looking for anxiety and depression screening has increased by 93% over the course of COVID. What we're realizing is that all of us will experience some depression or anxiety. And will there be enough resources to support us in getting better? 1 out of 5 adults will experience some significant mental illness in their lifetime, and only 24% of those people will report an unmet need for treatment, which was also super alarming. So there's a tremendous need for services, and I think we kind of have to rethink what services mean. Can we train registered nurses that have an interest in mental health to provide some basic coaching? Can we increase the number of psych NPs in our university programs? How do we meet this growing demand for mental health clinicians?
When you say a significant mental health issue, name what those diagnoses are or those conditions.
When I think of significant mental health issues, I think of somebody who is having a major depressive disorder episode or such severe chronic anxiety that it affects their ability to function and live a full and purposeful, meaningful life. I don't think that we look at trauma enough. PTSD is going to be a huge issue post-COVID because we've all experienced this collective trauma. And for those of us who have had previous trauma in our lives, COVID has been really triggering any past psychological injuries. But then you also think of more severe and chronic mental illness, which are less common, but really do affect people significantly, like bipolar disorder or schizophrenia. They're less prevalent, but they are chronic, and we don't do a good enough job supporting people with those two specific diagnoses.
How did the moment hit you, to say, I mean, you already knew that there was a need. That's what you've been dealing with. But when you were thinking about, gosh, how am I going to deliver care? Can you walk through your, the light bulb moment for the two of you of thinking, okay, here's the need. Here's what we're going to do.
We were constantly being contacted by our friends and our families and our colleagues for mental health referrals. And everybody in my network was at full capacity. They weren't taking any more clients or patients. And the narrative that I kept hearing from my friends and colleagues were that they were having a lot of difficulty kind of navigating this mental health system. So they did not know how to find a therapist online. They didn't know the difference between a psych NP and a therapist. They couldn't find a provider that took insurance. Nobody was answering their phones. Nobody was returning emails. There was not pricing transparency for private pay services. So they were already feeling so low and depressed and anxious and being re-traumatized in the process of seeking care and trying to access care. Pritma and I felt there was a real time-sensitive need for an online psychiatry and therapy office that was super responsive and kind at every moment of the client journey.
When you were describing that, I'm thinking how many times I have had somebody reach out to me seeking resources. And my experience in helping to navigate them has actually been really quite traumatic. I mean, you've got somebody who is struggling. They finally raise their hand to say, I need help. And then the process of getting help is so challenging. I think it de-incentivizes or even demoralizes people they don't even have the energy, to try to seek care. So can you walk through, before Lavender, what is the standard, more traditional pathway of how people can seek mental health and behavioral health resources?
I would say in general, unfortunately, people don't seek help until they're in crisis. So we do not have a preventative mental health system in the United States. You can't even bill. Insurance will not pay a psych NP or a therapist for some sort of like preventative mental health annual assessment. So traditionally, most people are really only accessing and seeking help when they really need it most and are very, very sick.
And then when they're in crisis, it's a totally different type of care that they need at that point. And Pritma, you're in Canada, so you really have the ability to look at two different healthcare systems. Can you comment on what the pathway for seeking services like in Canada?
Psychiatric services in Canada are not covered by our healthcare system except for acute care. So unfortunately, there's a gap there too, where if you need regular therapy or ongoing care as an outpatient, it's typically not covered unless it's through your private benefits plan. However, most employers do have excellent benefits, and I find the access is much easier. There aren't as many barriers, and particularly where I'm finding there's a significant amount of barriers, which has been such a learning curve for me and quite alarming for me to see in the United States, is the barriers surrounding medication and pharmaceuticals. We deal on a daily basis with prior authorizations and a variety of hurdles that the insurance companies are putting forward, and spend countless amount of hours as an operational team on the phone with insurance and pharmacies. So in the States, it's not only a barrier in accessing care, but then even maintaining and continuing care has been quite laborious, is what I've learned.
Right.
To just understand how much time one medication takes to be covered by an insurance panel. Last week, we spent 10 hours in total trying to get a prescription covered for a patient by their private insurance company.
Why? You're licensed to prescribe, the diagnosis is there, the medications are there to help somebody. Why is there a problem?
In this particular example, the insurance company would only pay for a certain generic manufacturer of the medication. So both our team and the client had to call over 15 pharmacies and ask them if they carried the specific generic manufacturer, and very few pharmacies did. And then we had to resend the prescription to all these different pharmacies to test if at that point the prescription would be covered. So that's what was happening there. But not every practice necessarily has the administrative support to do that. 10 hours is quite a lot of time. If you're a private therapist or a private psychiatrist in practice, you may not have a secretary or a front desk person who's able to do that. So people really go without their medications.
I was thinking about the client, that sense of how hurtful. Okay, I've admitted that I'm struggling. I've humbled myself to ask for help. Now we've figured out what will help. Why is it that people are putting so many barriers in my pathway to secure the help that I need? Clearly, the two of you have been studying the challenges and the problems and the barriers that exist within mental health care services and pushing that up against this huge demand. You understand those problems and the need quite well. How did you use that in designing Lavender?
Well, really at the crux of it, with Lavender, we wanted to make care more affordable and accessible to all. And we look at that through every point in the client's journey, whether it's that initial phone call they make. We're really taking best practices from other industries and applying them into Lavender. So we're looking at call center best practices in terms of first call resolution. And we're ensuring that we're responsive and we're answering the phone, we're responding to emails. We have targets set in terms of how quickly we want to respond, often within 2 to 4 hours is what our target is. So we really feel that when a client is in need and when they gain the courage to make that call or send that email is when we really need to respond. Then from that point forward, we want the client journey to be as simple and easy as possible. So we're very laser focused on the number of times we're contacting a client, the booking process, things that are not innovative in other industries are quite innovative in psychiatry, where we offer online booking. So at midnight, when a client decides, I need help, they can go online and they can book an appointment with us. Whereas that's not available with most psychiatry offices. We are accessible through email. We're accessible through text. We're actually just launching a new chat feature on the website as well, because we want multiple channels through which clients can reach us. Our concierge team, they're available 7 days a week. And that's really important to us. So that's the accessibility piece. And the affordability piece, we really wanted to provide a model that is affordable. And we do that by setting our prices in such a way that they are competitive. But also our model is unique where we provide both therapy and medication management within one visit. And that saves clients time and money. And it improves clinical outcomes when the same provider is working with them on both.
So I want to follow up on 2 points that you brought out, which I think are unique, distinctive, and wonderful, quite honestly. Your provider team and being able to combine medication management and therapy within one visit. That has been the real challenge for so many people. So who's on your provider team and this model that you have around collaborative rounding? Explain how it works.
Certainly. So our team is made up of all nurse practitioners that are trained in both medication management and therapy. And then we also have this collaborative rounding program that we leverage in our partnerships with therapists. So, for example, there are cases that require more complex therapy modalities. And so when we find ourselves in that situation, we partner with therapists that have specialties in that area. And our provider will join the therapy session for 20 minutes, where the three of them, the client and the therapist and our nurse practitioner, can work together on a treatment plan with regards to medication management.
Okay, so help us understand when you say therapist, social workers, and when you're talking about the different types of conditions, can you get more specific and give us an instance of maybe a client that you've worked with that falls into the categories that you've just been describing?
It's interesting you bring that up, Shauna, because it's even confusing for me. And I've worked in mental health for many years.
I'm not the only one.
Yeah. To distinguish between all the different types of professionals in which you can receive mental health support from. There's psychologists, there's psych NPs, there's licensed counselors, there's coaches. And I think as a consumer of mental health services, it's extremely confusing and difficult to navigate. So when we say therapist, it can be a social worker, it can be a psychologist, it could be a psych NP who does therapy. And in this specific case, our first collaborative rounding client was a client who had pretty significant bipolar disorder, had multiple hospitalizations, including a few hospitalizations this year. And she had a very good rapport with her psychologist, who she saw 3 times a week. She was taking lithium, which is a very helpful medication, but requires a lot of lab work. And we really wanted to do whatever we could to support her. So we supported her through this collaborative rounding program where we worked in partnership with the client and her therapist, who was a social worker.
Okay. So how are you doing that online? I'm envisioning traditional rounding. You got a group of people going in to see a patient or a client. They're all together. How are you managing that online? Zoom party?
That's exactly it. Yeah, it's a three-way video call with the client and the nurse practitioner, and then their therapy provider. Yeah, so that's how we do it. And funny thing, Bridget, remember when you had to school me at the very beginning about all of the different roles? I was confused, like I didn't even know. And so I had to, it actually took several times of Bridget explaining it to me and then understanding the different credentials and qualifications. And it gets even more complex when insurance is involved and the billing codes. I had to figure out the billing codes and who was able to bill what. And then, clients receive these statements from their insurance providers as well, and they're equally as confused as to what's a very confusing space to navigate, for sure.
When you say you're making it affordable and you're making the prices transparent, what are the numbers on that? How much does care typically cost?
So on average, clients are looking at paying $400 to $600 for their initial consultation with a psychiatric provider, whether that's a psych NP or a psychiatrist. So it's very, very expensive. And then the follow-up sessions are typically, 20 minutes, and those are anywhere between $200 and $400. And that in and of itself is quite a barrier if someone is not insured, especially during these times when there's so many job losses. So in comparison to that, at Lavender, we charge $300 for an initial consultation, and it's 60 minutes versus the typical 40 minutes. And then our follow-up sessions are actually unique as well, where we have a long, medium, and short follow-up because we really believe that a client's needs change week over week. And we don't prescribe or dictate to clients that you have to see us every week for an hour. It's really dependent on how the client is doing, whether they need to see us or not, and whether they want 60, 40, or 20 minutes with us. That's up to their discretion. And the prices for that range from $140 to $220.
So the way you're describing the complexity, the level of confusion, this is just a ripe field for innovation. So why is it that the field of psychiatric care, mental health, and behavioral health, why is it so slow to innovate?
I think there is such a need for mental health services that in a way, practices and individual providers don't really need to compete for clients. There is such a need and there's just not enough services. So when Pritma and I started Lavender, part of our journey was thinking, what would a online psychiatry and therapy office look like if we actually had to compete for clients? So I think that is one of the main reasons there has not been a lot of innovation. For example, it's fairly unusual that we take insurance. About 90% of our clients use their private health insurance. Most practices, at least in New York City, most therapists and psychiatrists do not take insurance. They don't have to because clients will come and pay privately because the need is so great.
Wow. That's interesting that the way you set that up, which is if you had to compete with other online psychiatric services, what would you do differently? You start putting on that hat and that experience that you have with data and technology, transforming care. When you start applying that to mental health, what are the shifts that you guys are driving?
Yeah, that's a really great question. So Bridget and I really, the nice thing about how we set up Lavender, because we've done it before, is we actually set things up to scale and with the end in mind. We knew that when we launch this, if we launch it, when we launch it, we will have a ton of data. We will be capturing a lot of data on the back end with regards to client demographics and treatment plans and all sorts of information, which we're currently collecting. And so how do we use that information to drive further quality outcomes? We're really excited to look into our data to see how do nurse practitioners impact mental health outcomes? How can this impact insurance and fee guides and support a mental wellness system versus a mental health system, a reactive system versus a proactive system, right? So we're actually in preliminary conversations with a couple of universities to really dig into our data further. But that's something that really excites us, is how can the information that we're gathering on the back end of this really improve mental health care for all globally.
Well, I wanted to pick up on both of you had mentioned that within, whether it's in the US or in Canada, and it's probably like this throughout most of the globe, nobody's really addressing the preventive care. We are treating mental health and behavioral health in crisis management, basically. So as you are designing Lavender and you're picking up this data and using all of those skills that you have for surveillance, prediction, access, and treatment, what does a preventive mental wellness model look like? What can we do?
Well, I think the first thing is that insurance companies need to start reimbursing therapists and psychiatrists and psych NPs for a preventative annual mental health visit like we do in primary care. So currently, I would not be able to bill insurance and see a patient unless I diagnose them with some sort of mental health condition. So you can't use your insurance if you're feeling good. Yeah.
I think the next step would be also just more interdisciplinary collaboration, right? So among healthcare teams, we really need to have a more collaborative healthcare team to look at preventative healthcare, not only from the mind and body and spirit connection, right? So we have to look at everything. And also, how do we incorporate that through some of these wellness apps? You know, with the pandemic, I think that's really opened our eyes to how can we better leverage some of these tools that clients are using within their homes, right? And how do we embrace those tools? There's been so many barriers to using these tools in the past, and I'm really hoping that in the post-pandemic era that we've reduced some of that red tape and that COVID has propagated some further discussion and movement in healthcare professionals leveraging some of these apps and bringing them into their practices and into their health records. So I really think that this has pushed that agenda forward and will continue to do that. And I think that's going to be an enormous next step.
The mental health apps and the digital therapeutic space, I find this incredibly fascinating and very hopeful when we think about this preventive model and intervening much earlier in a way that maybe it stabilizes someone or maybe even actually manages or interrupts whatever that depressive or anxiety producing event might be. Can you first of all describe what some of the mental health apps are and how they're being used? Can you say more about them?
Yeah, I mean, there's a lot of amazing. I mean, there's almost too many to choose from, which that's a struggle that providers and clients have as well, is which one is most evidence-based. There's a lot of mental health apps, whether, you know, you're looking for talking to someone through an app and receiving therapy through texting, whether you're looking for wellness exercises and breathing exercises. There's a myriad of apps. And I think what we've not done well is figured out what is ideal, what are clients needing. And I think there's an opportunity for different disciplines to work together to create more evidence-based apps that will then also plug into electronic health systems and into the way that we work as providers so that we're more apt to adopt them, if that makes any sense.
Yeah, it does. And we're talking about mental health apps in a very broad and general way. What type of conditions are being managed through an app?
Yeah, I mean, the apps are so interesting, Shauna, because in some ways I'm really excited by them because talk about accessibility, right? Like a lot of them are free.
Right.
You can access them in the moment. You don't have to navigate any mental health system to access them. But on the other hand, as Pritma was mentioning, I can tell you as a provider, I find it very overwhelming and I don't know which app to recommend to my patients. And I really care about my patients. So I don't want to recommend something that is not going to be helpful to them or maybe could even do harm. People who have chronic mental illness, they are often people who don't have as many resources as other people, like homeless people or people that are incarcerated, and they may not have a smartphone to access an app.
Right.
If apps are the future, we have to find a way for those communities to have access to them.
It's really hard for people to ask for help. And I just want to comment, your website what I love about it when I go on it is that sense of joy. You've got this, it looks like some hip kid dancing out on the streets. And the moment I go there, I'm thinking, oh, I already feel better.
Well, thank you for saying that, because I think from the very beginning, that was our purpose in developing our website and creating our name. Even we wanted everything to sound very positive and soothing and normal, because we want to normalize mental health and we want to normalize therapy. The images on our website were very important. We wanted them to be positive because happy people need therapy as well, and they need intervention as well.
When you start a business, one of the first things you do is you look at your competitors' websites and their names. And what we notice is that the tendency in mental health is to have names of practices that are sort of sad, depressing, and also imagery on websites that are black and white and people looking sad. And I know for myself, as someone who has had my own mental health struggles, I don't find that helpful when seeking care. So Pritma came up with the name Lavender, and we instantly loved it because it makes me smile. It makes me feel calm. It makes me feel hopeful. People have joyful moments in therapy where they laugh with their therapists and their providers, and it's not all dark. We really wanted that to come through in the name.
And lavender is a stress reliever, right? So we didn't want the name to represent the services that we deliver, because that's just too literal. And that literal sense of any of those words, it sometimes has a negative connotation to it. So we wanted a positive connotation and something that sounded very soothing. And lavender was it.
We hear the term stigma around mental health being used. What would you like to say about stigma, and how is lavender helping to make it less intimidating, or what are you doing to make it easier to ask for help?
We call our patients clients. And even when we interview nurse practitioners, professionally, we're very used to saying patient. And we intentionally said, no, these are our clients. Nobody wants to be called a patient, especially in outpatient services. And so that's one way that we're trying to destigmatize mental health services. And I think also just with regards to it being a fully online psychiatry and therapy office, when you're accessing these services out of the comfort of your home, you're not having to go to a specific office. You're not having to wait in a waiting room. And so we've actually noticed that a lot of people are seeking out services and receiving care because telepsychiatry is available, whereas otherwise they wouldn't have stepped foot inside of an office or a clinic. We also hear from our providers that they're able to develop rapport a lot more quickly over telepsychiatry because they're they're seeing them in their home environment, how they're dressed and where they are and what their home looks like, and they're really able to establish that rapport very quickly is what we're hearing. And Brighid, I'll pass it over to you to add to that.
Yeah, I think there's an interesting thing that's happening where the playing field is a little more equal when you're seeing someone in their home, and it's a richer therapy experience for them because they're seeing the client in their home and the client is also seeing them in their home. There's kind of this natural intimacy that happens that allows the providers to have a stronger rapport faster.
So just the setting helps to remove the stigma. Yeah. Well, when you say that, I'm thinking about, okay, so I've got an appointment on my calendar. I need to figure out transportation. Then I go check in with the receptionist. I'm sitting in this reception area, and all of these things are signaling to me, man, you got problems. You got problems, as opposed to clicking on a link and saying, everybody has this. I don't feel so alone. I hadn't really considered that until you just said that about the online access and that online experience being a way that you can actually reduce stigma.
Yeah, I think what the pandemic has done, it's done a lot for deregulating barriers, right? And just deregulation overall in terms of scope of practice for nurse practitioners, for nurses, for a variety of professionals where we're able to provide better care faster to clients. It's created some insurance reform, whereas before a telepsychiatry visit was not able to be reimbursed as much as an in-person visit. And so it's reformed a lot of things. And then it's actually helped with the adoption of telemedicine overall, right? It's taken it 10 years further in the course of a year. So the pandemic has resulted in a lot more options for the client and a lot more options for the provider as well, and new ways of working for a variety of healthcare professionals where those options were not available to them in the past.
Yeah, the point that you bring up about the workforce, that there is such a shortage, and this is globally, of mental health care professionals. With Lavender, we've also got to build a workforce on all of this. And there was already such a shortage. So what are some of the things that you guys are doing that you might consider innovating to build the workforce, to mobilize the workforce, and just put the workforce where the need is?
We're hoping that we're helping to improve the access and the hours available of psychiatric care, because a lot of our providers actually, they work elsewhere as well. Some of them even work full-time elsewhere. And the nice thing about working at Lavender is they're able to pick up extra hours and serve additional clients from the comfort of their own home. So we have a model where we're open 7 days a week from 8 a.m. to 8 p.m. and providers actually have entire flexibility over their schedules where they're able to add their availability as they see fit, whatever works for them. We have full-time providers, we have part-time providers, we have providers that work as little as 4 hours a week. And that's because we really want to provide flexibility to our providers, and we want to ensure that they don't feel burnt out, that they're in control of their schedules, and that we're increasing that pool of resources for mental health services.
It feels very much like giving people control over their careers and their lives, which has not been something that healthcare has particularly been good at doing. It's the system dictates how you practice. And I wonder how many very well-trained practitioners at all levels are not active in the workforce just by virtue of the schedule or the location. Mm-hmm. And maybe you're reactivating a group of people where this really does fit their lifestyle. And I'm thinking particularly nurses. It's a profession that's populated predominantly by women in their childbearing years, or women who are taking care of other family members. Maybe this allows them to stay clinically active. Is this something that you're seeing? And maybe it's really helping us to improve the longevity of a clinical career.
100%. It has created so much mobility for nurse practitioners. And the funny thing is, I laughed when you were saying that, because we have a 1 hour kind of onboarding call initially with our nurse practitioners once they've signed the contract, just to go over paperwork and things and the plan and when their start date is and what their schedule is going to look like. Honestly, in that 1 hour call, it takes half an hour just for them to realize that they can make their own schedule, because we ask them for their first month schedule in that call, and they're like, "What do you mean?
You're not going to give me my schedule?"
To me? And I have to, I'm like, "Okay, so when do you want to start?" They're like, "I get to pick when I start." I'm like, "Yeah. So when is your first day? And okay, then in that week, what days would you like to work and what times?" And I actually have to coax that out of them because it's so unheard of for them. Yeah, it's so foreign, and they're just not used to it at all. So it's a new way of working for all of them. I'd say all of our providers had that initial shock. And then, in terms of mobility, one provider is looking to work from Florida. So it provides this geographical mobility as well, where they don't necessarily need to be in the state in which they practice. They could be living elsewhere, in this case, to be closer to her parents. They're getting older, and so she wanted to be closer to them. So it provides a lot of flexibility, a lot of mobility, and it's a completely new way of working. So these providers are trying to navigate, not only the tech and all of these new flexibilities while they're engaging with their clients. So it's been interesting and a learning experience for sure.
Yeah. Well, I think that the focus with Lavender and the excitement has been, gosh, we're innovating in psychiatric and mental health care services. there's this whole other story of how you guys are innovating in workforce, and how do we bring together clinical services, really. I mean, much of this is clinical services that, you're innovating on how that workforce operates, just your onboarding, your recruiting, the way that they are working. I don't know that that's been the story that's been told very well. And I was just wondering if you wanted to add a couple of other ways where you're thinking about innovating as far as business processes. I mean, you had mentioned earlier, Pritma, about looking at other industries to see how they have solved the simple things that maybe healthcare has just not paid enough attention to.
For sure. I mean, like, we consider ourselves just a small group practice, right? I mean, we are growing exponentially, but essentially we're just a small group practice. And the difference is that we're online. What we were finding is that we were dropping the ball. We were not meeting our goal of responding to clients quickly enough. We were missing some emails and phone calls and things like that. And we looked at other industries as to how do other industries do this? And we realized we need a ticketing system. We need an omni-channel solution through which all of our phone calls come in, all of our emails come in, our agents, our concierge team can communicate with one another. So we adopted an omni-channel solution. So when you call like your credit card company or your cable company, you know how you're talking to one person and they know, oh yeah, you talked to my colleague so-and-so. And it just seems like it's this effortless kind of one experience. And so they're using a system like that where they can see the entire history, all the previous issues that you've called in for, all of your emails, your phone calls. And so we launched that, and it's been such a success. But that is very untraditional for a healthcare practice to implement. So that's just one way in which we're innovating in terms of the tools that we use, and being a remote workforce as well. We're trying to figure out new and innovative ways to keep our providers engaged, right? So we have these 2-minute videos that we do every Friday, Bridget and I, on updates on the company because things are changing very quickly. So we do those weekly, continuing to look at how do we keep the team engaged, seeing as we're remote, and actually many of us have never met each other face to face. So it is an entirely new way of working and a different way of thinking that we really have to stretch ourselves and figure out new and innovative solutions just to build and grow the culture that we're envisioning for Lavender.
Yeah, so you guys are innovating on the primary mission of making mental health care services more accessible and more affordable, building it with a remote workforce using online and digital tools. So 360-degree innovation there. I wanted to go back to the mental health and the different populations. Bridget, with your experience working with nursing homes and our elderly population, man, have they been hit hard. They were already somewhat more isolated and removed from a lot of the traditional social interactions just by virtue of probably their physical limitations. But the pandemic really accelerated that. And then we've also seen that with school children and college students. I'm curious, as the clinician, what should we be paying attention to for each one of those specific populations? But then also collectively, there have been so many lives lost, so many people who have lost loved ones, and we've not had the traditional ways of gathering for grieving and support. So I'm asking you as the psych NP, what's your diagnosis and what should we be doing to take care of our collective mental health?
Well, we've all had this collective trauma. And when you traditionally think of collective trauma, you think of wars. And in a lot of ways, we've experienced a war, but the villain was a virus. So I think what we know about trauma and collective trauma is one of the most helpful things is to make meaning of what happened. And I think that that's what we need to do a lot of work doing in this next year as a community, start making meaning of what happened to us during the pandemic. And that is the only thing that's going to give us the energy and the motivation and the hope to kind of like keep going and also rebuild this new world, because it is not the same world that it was in 2018 or even 2019. We really need to rebuild and do better. So meaning making is probably the most helpful thing that we can all be doing right now. And you can do that. You don't need a professional mental health counselor to do that. You can have conversations with your friends and your families and your colleagues and start making meaning of the last year.
And I guess that shows up in terms of journaling and music and creative outlets. What are some of the other things that you'd recommend that are going to help us to make meaning? What do you suggest?
Yeah, I mean, you mentioned a lot of them: making art, journaling, bearing witness to other people's stories. So just listening to other people's experiences of the pandemic, and then vice versa, sharing your experience of the pandemic and just having someone really deeply listen and bear witness to that. I think just talking about it sounds really simple, but just starting to talk about it is going to be extremely helpful to people.
Brighid Gannon is a psychiatric nurse practitioner and the founder of Ivy Psychiatry, a co-practicing community of psychiatric nurse providers who work collaboratively with psychiatrists in providing consultation to nursing home residents in Georgia, New York, and Vermont. Pritma Dhillon Chattha, a Canadian treasure, is a serial entrepreneur and a nurse executive with deep expertise in clinical informatics and is known for being an ideas person. Big and bold ideas, value, impact, and data-driven ideas, but she has an uncanny knack and persistence in successfully commercializing and bringing to market. She also serves as adjunct faculty at the University of Calgary and University of Victoria. Together, they are the co-founders of Lavender, an online psychiatry and therapy service committed to making care accessible and affordable. And they are on a mission to modernize the mental health care experience that meets the moment, the need, and ensures a friction-free care journey and effective care in a timely manner. COVID-19 presented an important opportunity for long overdue innovation in mental health and psychiatry services. With everyone, everywhere, affected in some way by the stress, anxiety, isolation, and loss, our public health and our personal health conversations acknowledged an existing and a skyrocketing demand for mental health services. This demand, coupled with unprecedented reliance, adoption, and rapid expansion of telehealth services, and a regulatory relaxation on the policies and payment restrictions on telehealth services, are three factors that have proven favorable to mental health innovators and entrepreneurs. While the majority of innovations, such as Lavender, have focused on expanding access to mental health care, Pritma and Brighid also identify that far more innovation is needed for meaningful improvement in mental health and wellness. And as they both emphasize, innovations are sorely needed to normalize mental health, wellness, and also to care for people with serious mental illness. Brighid highlights that many people in need of mental health care do not get treatment, that a business model for preventive mental health doesn't really exist, that the process of accessing and even continuing with care and therapy more often than not is difficult, it's discouraging, even demoralizing. And this experience is faced by individuals at a time and in a condition when they're at their lowest energy, coping skills, and resilience. Lavender is embracing many avenues of innovation, and their shift to online telepsychiatry offers an unprecedented opportunity to collect practice and outcomes data and learn iteratively about how to improve treatment plans and quality and understand a nurse practitioner's impact on mental health outcomes, and an even more ambitious goal, how their data can improve mental health care for all globally. They're also advocating for and embracing regulatory change and helping to build the framework that includes safety, clinical efficacy, and data security. They're exploring effective and evidence-based digital mental health apps that are using face recognition, sentiment and linguistic analysis, voice biomarkers to capture mood and coherence, and doing so in a way that's safe for users, while also being mindful that as we move increasingly digital, we need to do so in a way that doesn't leave anyone out because they lack a device or digital access. Lavender is also innovating on the supply side of mental health and doing so in how they build business processes and baking in the technology and practices so prevalent in other industries and establishing themselves as workforce innovators in how they build and cultivate and deploy a workforce that delivers and coordinates care that is, in their words, convenient, transparent, and kind at every step. As May is the month that the world unites to celebrate mental health awareness, it's a great opportunity to highlight the growth and the progress that we as a society have made in accepting the realities of mental health while also raising the awareness to the barriers that still stand in our way. May 2020 was, well, it was tough. We were in the midst of the pandemic, grasping at straws for information, a light at the end of the tunnel, a return to familiar routines and rituals. Mental health was on our minds, but taking care of it was really quite difficult then. And celebrating it? Oh, that was even harder. For 2021, we want to acknowledge everything we have shared, faced, and will continue to overcome. We want to honor the resilience of the mental health community, the life-saving work done by our frontliners and our first responders, and the actions taken by practitioners and innovators to get people the care they need, to normalize mental health services, and as Brighid says, to talk about, to deeply listen, and start making meaning of what happened to us during the pandemic. For See You Now, I'm Shauna Butler. Thank you for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.